Hello, I'm Commissioner Howard Spence representing the 4th District here in Eaton County, which encompasses a part of Delta Township. One of the issues which the Eaton County Board of Commissioners presently is attempting to resolve relates to an anticipated or projected unfunded liability for the county, which would result if we continue to maintain the benefit levels at the present level for Eaton County employees, in particular if we continue to maintain post-retirement health insurance benefits for some employees who are at the present time still working for the county and are perhaps more than 10 years away from retirement. What the problem is that based upon actuarial projections and analysis, if we continue to maintain the benefits that we presently offer to the newer employees who are still here, which would basically provide that the county pays the full amount for their health insurance benefits following their retirement from the county, then we would at some point in time, perhaps 15 years into the future, face a situation where we actually have to come up with additional monies to pay for these health insurance benefits. The county actually is a self-insurer. What that means is that from the tax dollars which are collected, there is a certain amount of money put into the budget which is used to pay anticipated health insurance claims for all of the county's employees and for the county's employees who are already retired. If the health claims are greater than what has been budgeted or anticipated, then the county would be in a situation where it would either have to default and not pay for the benefits which it has promised to its employees, or it would have to reallocate the money, move the money from other projects such as building infrastructure, current salaries and benefits, a whole host of things where the county's money, taxpayers' dollars go, and would have to move that into an account to pay for the health insurance claims which are presented, which are unfunded. The Board of Commissioners has before it a proposal to limit the health insurance claims for a small group of the employees, not for employees who are already retired, and there are a number of different variations of the proposal which could be considered to provide cost containment to make sure that the county is able to pay the health insurance claims and its other bills and priorities into the future. John Fuentes, who is the county controller, has provided the Board of Commissioners with some background information at a workshop meeting of the board which was held January 30th in the Eaton County Courthouse. That material is posted online here on this web page for consideration of the general public. It is public information. That material includes an actuarial report provided to the county which, based upon some assumptions about investment income and anticipated claims, leads to a projection that at some point in the not too far future the county may have a deficit or unfunded liability of over $40 million, which is a very significant amount in terms of the typical annual budget for this county. And this project is not, this projected deficit and problem is not peculiar to Eaton County. More and more governmental agencies and other entities are starting to realize that the growth of health insurance costs could lead to a situation where the rest of the budget of that organization, whether it's government or private sector, is eaten up by healthcare costs and benefits which have historically been promised to employees. And this is a significant issue and problem not only in Eaton County but nationwide. We see some of the discussion which was related to the Affordable Health Care Act or Obamacare dealt with the fact that health care costs were going up and the federal government needed to take some actions to increase the number of individuals who would have access to health insurance, while at the same time taking measures to decelerate or slow down the growth of health care costs. And at this point in time, no one knows what the benefits and virtues of the Obamacare types of federal health insurance laws will have here in Michigan. It could certainly affect the unfunded liability and the cost of health insurance for Eaton County employees, both current and retired, in the future. And so we're going to have to continue to watch that. But in any case, the actuaries have brought to our attention that there is this unfunded liability, which recent changes in accounting law require that now we reflect those unfunded liabilities on the county's balance sheet, so that potentially there could even be an impact on a determination of the county's creditworthiness for bonding or borrowing money or whatever purposes in the future, based upon the fact that it now becomes very obvious that we have a potential unfunded liability for health insurance and other costs which we have not yet addressed or come up with a solution. So that's the background that led to this proposal. A copy of the proposal which the county controller submitted to the board for consideration is also incorporated or embedded into this web page for your consideration. The proposal, as I indicated, only addresses or looks at costs that could be saved by limiting or doing away with health care benefits for a certain group of presently employed county employees that would perhaps at the time they reach Medicare eligibility age, which is I think 66, the county would stop contributing. At the present time, the county continues to provide health insurance benefit for retirees, some retirees, even after they have reached that Medicare eligible age. So there are a number of different ways to address this unfunded liability, and it's a difficult issue. I've included the actuary reports and analysis on this webpage, but to be very honest with you, the concepts are somewhat complex, and there's a lot of ifs involved, a lot of variables and assumptions which, if there is a small change in any of those assumptions, could certainly either raise or reduce the potential unfunded liability in the future. And that's the problem that the Board of Commissioners is presently struggling with. And like I said, it's not easy. I have to indicate that at the present time, I think the responsible thing to do is to be aware of the fact that the Board of Commissioners has to take actions which would protect the financial health of the county and do it in a manner which would not potentially overburden the taxpayers of Eaton County and cause future generations, whether it's only 10 years or 20 years down the road, to have liabilities which could impact on their taxes and the creditworthiness of the county. The question becomes, is now the time that we need to actually address this problem, or can we kick it down the road a little bit, which is what politicians and bureaucrats tend to do. If we don't have to address the problem now, wait until a crisis develops and then see if you can address it at that point in time. Controller Fuentes indicated at the insurance workshop, which was held on January 30th that in approximately 2 years we would reach a tipping point where the cost of anticipated claims for all of our county employees, not just retirees, would be greater than the amount that we're presently budgeting and allocating, and we would, in a couple of years, maybe 3, need to start changing the priorities in our budget if we continued with the same benefit packages that we have, because we would have to generate and allocate the money necessary to pay those healthcare claims on a pay-as-you-go basis, since we are a self-insurer. So that's the issue, and the problem that arises is just as is the case in so many public policy decisions and debates in government. You're weighing fiscal responsibility against the interests or needs of people, in this case county employees, and you need to be aware of certain fairness issues, and I have to be open and indicate that my background, I am a former state employee, state of Michigan employee, and I'm presently a pensioner. I receive a pension, and I receive retiree benefits from the state of Michigan, and I can understand that even a few dollars difference in that pension payment and a few dollars difference in the benefits that the government provides to its pensioners or retirees can have a significant difference. And I felt the pain myself somewhat in terms of reductions in benefits, or health care benefits at least on the state level, and it's been complicated or compounded by the fact that my pension has become taxed by the state within the past couple of years due to changes in the law, and so my pension has been reduced by 4%, and I miss that 4%, and I can empathize and sympathize with county employees who look at the fact that once they are retired and are no longer making an income to support themselves that's growing and escalating, if they're relying on a pension or whatever retirement benefit they may have, that you could very easily find yourself in a situation where you are retired with no income, no prospect of a second career following retirement because of age or whatever, and your buying power, your living power is going down faster than your bills and living expenses. So that's the rub, or the public policy debate, weighing how do we be physically responsible and at the same time be responsible and fair to the employees. And questions arise, are there other ways that we could address this unfunded liability? And some of the commissioners, and to a certain extent myself, feel that we certainly don't want to be taking money out of the pocket of our employees and our future retirees if we don't have to. But at least at this point in time, if we address the issue, the present employees who are not yet retired may have 10 or 15 years to make adjustments in their lifestyle, their retirement plans, to accommodate what changes we may make. So at this point, as we continue on that public policy debate and discussion, I am encouraging individual residents, citizens throughout the county, and also county employees to provide their input, and I have on this webpage links and common opportunities. I also am putting up some surveys requesting that we get some sort of additional input into how we should or could address this funding problem. There are other ways of dealing with those problems. Chairman Mulder has indicated a willingness to have Controller Fuentes seek to determine if there are other ways that we could get cost containment, reduce our anticipated unfunded liability for retiree benefits and health insurance, and we're certainly going to be looking forward to receiving that additional input from the controller and consultants or experts that he may retain to help him come up with a proposal. So I encourage you to talk to your commissioner, to talk to me, to talk to your friends, and to share your thoughts, if you have any, on this issue, because basically the decision will have to be made. Is this something that the present Board of Commissioners is going to review, address, and decide at some point within the next few months, or are we going to kick it down the road and let some future Board of Commissioners address this issue when it may be more difficult to actually approach and successfully address? So I'm looking forward to your comments, and I thank you for your time and consideration, and I'm sure all of the commissioners would appreciate any feedback that you are willing or able to give. So have a great day, and I'm looking forward to hearing from you. Thanks.